Hi everyone. My name is Helen Stirling-Knight. We haven't been introduced yet before, but I intended on making a different video for my first ever YouTube video, but YouTube has a deficit that I feel I need to fill. I am a person who is living with Mixed Connective Tissue Disease. What that is it's an autoimmune disease that can basically mimic all of the other autoimmune diseases whenever the hell it feels like it. Um, Because of this, it's very difficult to find the right medication for treating it. Recently, actually yesterday, I had my first infusion of Rituxan, or Rituximab. The night before I had my infusion, it took me until about 8 p.m. Pacific Standard Time to realize I was even scared. And I went to look up YouTube videos from people who had had the infusions before and found that there were pretty much none. There were a few, there were a couple, but most of them were advising against it or, giving the actual clinical processes, la 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 la. And I was like, this doesn't work for me. I need somebody who has had it before. So I decided that I would make a video myself describing my first experience on Rituxan. Rituxan is an IV infusion medication, and you go to your local oncology center, whatever your health insurance covers, and you sit there for 6 hours with an IV in your arm, and this medication is pumped into you. It can take up to 6 hours. It can take less than that, depending on how your body responds to the medication. But I wanted to put some fears to rest, because I had my infusion yesterday, and it was honestly one of the easiest things I've ever done in my entire life. To preface, I am a needle phobe. Yes, I have a tongue piercing. Yes, I have my bridge pierced. I've got my ears pierced. I want tattoos, just haven't happened yet. The first piercing I got was actually, besides my ears, was an eyebrow piercing. But when it comes to things like shots or injections of any sort, blood drawing, I can't do needles. They scare the living hell out of me. And so when I went in yesterday, I was really scared about that. I was also scared of the side effects or potential side effects. My biggest fear when it comes to side effects of medications is nausea. I hate nausea. I do not like being nauseous for long periods of time. I actually carry around a little, ladybug stuffed animal thing that has, it has a shell like a ladybug would, but it's a zipper pouch, and I carry that around, and it's constantly full of mints. Because I guess I'm just kind of an old lady like that. I carry mints around everywhere. You can always trust to ask me for mints, whether you just have bad breath or whether you're nauseous. But, one thing that really helped me yesterday was bringing somebody with me. I brought my mom with me the first time. I'm only 21, still living at home. I'm in college full-time, so I can't really do a job right now, and with all my health issues, I can't really even fathom work at the moment. I look fine, but it's not for me right now. I need to finish college and get a really nice job where I can have more flexibility when it comes to my illness. Anyways, some of the other side effects, like there's nausea, vomiting, headaches, body pain. There's a lot of really scary stuff. You can go into anaphylaxis. It can cause internal bleeding. Also, I'm not a medical professional. This is purely just me, cut and dry, what I've read about it, giving my opinion. This is not any medical claim or any professional advice. This is just a person who's gone through it saying what they went through. Now I've got that out of the way. A lot of things can go wrong. It's scary. Even when you look at the statistics about how small that chance is, you end up asking yourself, is that me? am I going to be that 0.02%? There's always a possibility. You just have to gut up and face that, and that can be really difficult. I'm not saying it's easy. But I went in yesterday to my oncology clinic, and my oncologist was actually really nice. His name is Jeff. And he had kind of a dry sense of humor, but he did have a sense of humor, and it was really comforting. He only had to do the injection port once, and it didn't even leave that big of a mark. I don't even know if you can kind of see it. Right here, you can see that little red area and this little red dot. That is the actual injection site. And it's going to bruise. I know that it's going to bruise. It hasn't bruised yet, but basically what they do is you sit in a chair. You can choose any chair you want. It's a big open clinic. I tried to gravitate towards a more private area because I didn't know any of the people in there. It's my first time in there. I'm really not comfortable. And I actually ended up with a couple of really nice people sitting next to me, so that's cool. But you go in, you pick a chair. Near that chair, there will be a chair for a guest, and or they can bring out a chair for a guest if there isn't one. Usually they're reclining chairs so that if you need to kick back and sleep, you can, which I did need to at one point, but I'll get to that. And then there's the big tall machine rack that it's plugged into the wall. It looks like a coat hanger, honestly, but it has 4 hooks on either side to hang different various IV bags. From that, you go down it, and there's a little machine, and that's your pump. That's what allows you to control how fast your medication's going into you. And it allows your oncologist to say, okay, we can speed this up, or okay, we can slow this down. This needs to go slower. So you sit in the chair, get all comfy. They have outlets for you to plug in your phone, or if you bring a laptop with you, I definitely suggest bringing some form of entertainment. You're probably going to be there a while. So I sat down and took big deep breaths and let my mom hold my head while they put the IV port in. And then the first thing they do, there was other stuff that happened, but I'll do a personal blur later. The first thing you do is you get your pre-meds. They brought me a little cup, and in that little cup had some Tylenol and, oh, what was the other thing? There was another med that was in there too. I can't remember it right now. But they bring you some pills. You take those. You're good to go. Then they have, sorry, there's a hair. Then you have pre-meds that come in an IV bag. Very commonly with Rituxan or Rituximab. It's called both interchangeably. I call it Rituxan. They will give you steroids to kind of get your immune system to just kind of calm down off the bat. And it comes in a little bag. It's a very small bag, little IV bag. And then they give you the steroids as well as a big huge bag of, there we go, a big huge bag of saline. It's quite big. And they don't use all the saline in you right away. They might if they notice you're really dehydrated, but usually they don't. That bag of saline should last your entire treatment. So they do a mixture of the saline and the, I just said it, the steroid. I can't remember what the steroid's called. It's stronger than prednisone, though. If you've had any autoimmune disease, or if you've even had a severe allergic reaction, I'm sure you're familiar with prednisone. Severe prolonged allergic reaction. So they give you that, and there's lots of tubes. They connect it all together so that it's all dripping through one IV tube in your arm, but the bags are connected so that you're getting an even mixture of the two things, which is cool. But so they do that, and then once you're I'm sorry, I have such a space cadet brain right now. Once your steroids are all into your system, they unplug you from that part. Your port stays in. That's the only port you need the entire time. They unplug you from that part, and then they have your meds, your Rituxan, shipped up from pharmacy, and they plug you into that. And they start you off on the slowest they can go with it. I think if you're looking at the little vial that is connected to IV bags, it's actually a little plastic vial, but like I saw a drip maybe, I don't know, once every 5 seconds. They go really, really slow to start with because they want to be really careful with how your body reacts to the medication. So they'll go slow for about a half an hour. Also, they check your blood pressure a lot. Get used to that. They go slow for about a half an hour, and then the machine will beep and it'll let the doctor know, hey, you can check on your patient. So then the doctor will come back. Your oncologist will ask you how you're feeling a lot. If your oncologist is not asking you how you feel or how you're doing every time they come over, they're wrong. They need to be checking on you that much. So then they'll speed it up as your body allows it. If you start to have any back pain, shortness of breath, tightness in your chest, I felt hot flashes in my hands, like flashes of heat throughout my hands. And at some points, my hands started tingling. That's a neurological reaction. They may stop your medication for a little bit and just allow your body to relax with some saline. Or what my oncologist did was he brought over a nice little sized bag of liquid Benadryl. Liquid Benadryl makes you feel high. It makes you feel like you've taken drugs. Like, I felt floaty and out of my own body, and it was really, really hard to walk to the bathroom. So beware, the liquid Benadryl is going to feel like a thing. So he gave me some liquid Benadryl after I started to have some back pain. So that was good and weird and good, and it kept me from having any other allergic reactions. So I sat there, I actually took a nap after the Benadryl for about half an hour, 45 minutes maybe. Then I was pretty much awake the entire time. Like, I don't know if it was the steroids, because steroids really jack me up. They make me awake. They also made me really hungry. I had no nausea with this at all, and I have a very sensitive stomach. No nausea whatsoever. Bring food with you. Usually your oncology office will have some snacks and goodies hanging around. We had granola chewy bars, and we also had some Ritz crackers, like the peanut butter ones. Those were hanging around. That's good and great, but I was like ravenously hungry, and usually the food that is in the cafe is expensive. So bring your own lunch and like your own snacks and stuff. Try not to bring anything that's like super aromatic, because a lot of people in there start having sensitivities to things like smell or sometimes even sound. So when you bring your own stuff, like bring some headphones, bring some stuff that doesn't smell strong. Don't wear a lot of perfume or like really strong deodorant or cologne. Just be polite. Like, a lot of people in there are really, really tired and really suffering, and if you are too, you totally get it. So then I sat around for like 6 hours and had the IV going, and I was able to get up to full speed on my Rituxan infusion without any issues at all. It was totally fine. And one thing that I did notice was that after a while, I mean, the infusion stuff is cold, and so, like, My infusion port was here. The upper part of my arm around my elbow started to hurt and it felt cold. And I mentioned that to my oncologist, and he came back and he unhooked me from the stuff and drew some of my blood out to look at it to make sure I'm doing okay. And he's like, yeah, you're doing fine. And he pushed it back in, and I'm sitting here like, that was my blood. I just saw my blood. I feel a little weird. Blood usually doesn't make me queasy, but mine in tubular form does. But so it's fine. Bring, like, you can ask them for warm blankets and for pillows. They have those. But you can also bring your own blanket. You can bring your own pillow. I'm going to bring my own pillow next time, which will be in 2 weeks from now, because their pillows suck. They're flat and uncomfortable, and you can fluff them all you want, but you're going to be fluffing them every 10 minutes. The next time I do my infusion, it'll get started faster because we had to go through some paperwork stuff, but it's really easy. And I want to let you know, as a person who's thinking about getting Rituxan or wants to know more about it from the standpoint of somebody who's got it, it's probably going to be one of the easiest things of your life. Like, not hard. I hope you don't have any allergic reactions and stuff like that, but they're right there if you need them. And they're ready with EpiPens and Benadryl and freaking all the things in case something happens to you. And it can go straight in your veins so that you can stop the reaction like right then and there. You're gonna be okay. Don't be scared. Come prepared, but don't be scared. Also, the little machines run on a battery, so if you need to get up and go to the bathroom, you can actually like unplug it from the wall and take your pump with you. My camera just did a thing. But you're gonna be okay. I wished that there was somebody who could tell me that in a YouTube video, and there wasn't. So I'd like to be here for you now, saying that the infusion of Rituxan is nothing. It's so easy. This, like, last night after I got home, my arms, like, from my elbow up, and my hands were still tingly. I was still having a bit of a neurological reaction. But I went to bed and I woke up this morning and nothing. I'm good. So, yeah, just bring snacks, bring a friend, or a significant other, or a family member, bring somebody with you. They'll keep you entertained. You can keep each other entertained. Bring your homework. I mean, bring your college work, bring your like work if you have paperwork that you do for your job. Bring a blanket, bring pillows. I mean, just bring anything that's going to make you feel more comfortable. Seriously, just bring it in there. I had 4 bags with me yesterday of stuff. Like 4 reusable grocery bags of stuff. And it's all good. This is the day after, and like, I only felt a little tired. The back of my throat kind of hurt a bit, but that's because the wall between like your veins and the back of your throat is really thin, and you're pumping a lot of liquid into you all at once. So that's to be expected. The only things I woke up with this morning were that my throat was sore. This knuckle was still swollen, but that's just part of mixed connective tissue disease. And no nausea, no anything. I'm really glad there was no nausea. Oh my God. That is the best thing ever. But yeah, so Rituxan. It's not that scary. You're gonna be okay. You can like this video if you found it helpful or if you found it comforting. You can subscribe to my channel. It's brand new. This is literally the first video I am ever uploading to YouTube. That's why my background sucks. That's why my lighting sucks. My camera, thankfully, is not too sucky, and hopefully it won't take too long because I'm using a really good computer. But, yeah, you're gonna be okay. I was okay. It's okay. You might feel a little tired the next day. That's usually after any infusion, but, yeah, It's just a thing. So be brave, bring what you need, bring who you need, and I hope that your infusion goes well. I will be uploading another video in 2 weeks after my next infusion to let you know how it goes. And maybe I'll do a video next week. It is a channel. I should probably try to stay frequent. But thank you so much for watching, and I hope you have a good experience with your infusion or with your buddy who's getting an infusion. Love you all. Mwah. Good night.